Hello, everyone. Welcome. We're just allowing everyone to join before we get started. Okay. Well, in the interest of time, I'll go ahead and kick things off. Hello, my name is Nellie Sabor, and I'd like to welcome you to the Autism Intervention Research Network on Physical Health, the AARP January 2024 webinar, The Role of Big Data in Research on Autism and Physical Health, Challenges, Promising Approaches, and Real-World Implications. Thank you all for joining us today. Because of the number of participants, your audio will be muted throughout the call. However, you can submit questions at any point during the presentation via the Q&A feature or in the chat box on your webinar console. Just a friendly reminder, please be respectful when communicating in the chat and asking questions, and know that only questions or comments pertaining to the presentation will be addressed. The entire webinar is being recorded and will be available on our website, which we will put in the chat soon. You may also view the presenter slides to follow the presentation on our Google Drive below. I will also put that in the chat. And there will be a short evaluation survey at the close of the webinar. We invite you to provide feedback and provide suggestions for future webinars. So in the interest of time, we'll go ahead and get started. Next slide, please. There's Dr. Alice Clow. Next slide, please. First, we want to acknowledge the Health Resources and Services Administration as the funding source for the AARP. And next slide, please. So it is my honor to go ahead and pass it off to our panelists for today. Thank you all for joining.
Hello, everybody. This webinar will be discussion-based and interactive, we hope. So we look forward to hearing from audience members and learning more about your work over the course of this webinar. Our team on the AIRP Big Data Working Group will introduce ourselves. Please also introduce yourself using the chat function. So please include your name, affiliation, and any big data experience, challenge or question, or any comment that you have about the use of big data in autism research. So I'll kick us off. My name is Emily Hotez, and I'm an assistant professor in the UCLA David Geffen School of Medicine and a developmental psychologist by training. I am an AARP scientist working to advance research across the network and am a member of the Big Data Working Group. I will pass it off to Dr. Lindsay Shea.
Hi, everyone. Thanks for being here. Looking forward to the discussion. My name is Lindsay Shea, and I co-lead the Health Services and Systems node of AARP, and I direct the Policy and Analytics Center, which is based at the A.J. Drexel Autism Institute at Drexel University. I'm a health services and policy researcher focusing on the use of administrative and big data sources and the policy implications derived from that work. I will pass it to Dr. Rast.
Thank you. Hi, I'm Jessica. I am a research scientist at the A.J. Drexel Autism Institute. I'm an epidemiologist and I use a lot of big data, and I'm also looking forward to talking about big data, seeing what everyone's reactions to and questions are and use of big data are, because it's one of my favorite things to talk about. So Molly, I'll pass it to you.
Hi, everyone. My name is Molly Sadowski. I'm a research associate at the A.J. Drexel Autism Institute at the Policy and Analytics Center, and I am a member of the Health Systems and Services node, and I'm looking forward to talking with you all about big data today. Heather?
Hi, everyone. I am an associate professor, actually in the Faculty of Education at the University of Alberta in Canada. I'm also the chair of the Autistic and Neurodivergent Scholars Working for Equity in Research, which is one of the fantastic committees that is part of AIR-P, and we're called ANSWER. And I am very excited to explain or talk to you about how we can use participatory processes in big data. And I will pass it on to Jennifer.
Thanks, Heather. I'm Jen Ames. I'm a research scientist with the Autism Research Program at Kaiser Permanente, Northern California. And I work a lot with electronic health records, which can be a type of big data. And I'm affiliated with the Gender, Sexuality, and Reproductive Health node. So I'll pass it on to Laura.
Thanks, Jen. I'm Laura Graham Holmes. I'm an assistant professor at the Silverman School of Social Work at CUNY Hunter College in New York. I'm affiliated with the Gender, Sexuality, and Reproductive Health Node as well. And I think I'm interested in any big data that can speak to sort of under-researched areas like sexuality, reproductive health, gender diversity, LGBT health, all those exciting areas. So happy to be here.
And I will also just mention that we have two other AIRP node leaders here. We have Dr. Rajuta Wilson, if you want to introduce yourself as well.
Definitely. Thanks, Emily. Hi, everybody. Thanks for joining us today. My name is Rajuta Wilson. I am a pediatric neurologist, and I specialize in neurodevelopmental conditions. I am the director of the neurology node for the AIRP, where we broadly focus on better understanding co-occurring neurologic conditions that can occur in autistic individuals, and really from a multi-sort of method aspect, better understanding the prevalence of these, treatment around these, monitoring, building interventions, and educating larger providers around these co-occurring conditions. And I'm interested in how big data can inform some of those goals of the neurology node. Thank you.
Thank you. And we have Dr. Priyanka Fernandez as well.
Yes, hi, this is Priyanka Fernandez. I'm a physician trained in pediatrics, prevention, and public health. And I'm the co-lead for the community and lifestyle medicine nodes along with Dr. Pradnyani, who's not here today, and happy to be part of this conversation.
Excellent, thank you. And thank you to all of you who have put your introduction in the chat as well. Next slide, please. So we are offering this webinar in the hopes that those of you who are interested in working with large data sets in research on autism and physical health might want to collaborate with us or the broader network in some way. So one way to do that is to potentially work with us on the Big Data Working Group, which is a newly formed interdisciplinary committee focused on using large data sets to improve equity and health for autistic individuals. So we'd love to learn more about your work. Please respond to this poll using the link or QR code. And I can post the link in the chat if the QR code is difficult. So please take a moment and let us know what kinds of big data sources you've used in your autism research, if any, and what was your biggest potential challenge on this project. And I will read out some responses. I won't call you out by name unless you'd like me to. So please respond over the next minute or so, and we'll take a look at some of the responses. It looks like we have gotten some responses. So some of you have used quite a number of big data sources, including NAEP, which is a US DOE data set, Spark, medical record data, pulling de-identified data from electronic medical records. Other people have used Spark as well, other survey research. Wow, so some really rich experience using big data sources. I've also used some of this kind of data in my work as well. What was the biggest challenge on the project? Okay, so lots of challenges, no surprise there. A big challenge in non-autism specific data sets is the N of autistic individuals in the data set. Yeah, that has definitely been something that I've been encountering as well, particularly in data sets that were not built necessarily to assess large samples of autistic individuals. Absolutely. Not having access to the data myself or a final say in how we respond to reviewers or editors who might ask for more data analysis that's not within the scope of my project. Yeah, I've definitely experienced that as well with some of the really large data sets, potentially having someone else who's analyzing the data itself. Absolutely. Limitations on availability of variables that would help answer our research question. And yeah, being overwhelmed by all of the variables available, I definitely feel that as well. And then some people haven't had some big data experience. So that's really great to know. Some of you have got a lot of experience, a lot of challenges under your belt, and some people not yet delved into that world yet. So great to know. Next slide, please. So I mentioned already, I just got too excited, got ahead of myself, told you about the big data working group already. Next slide. So we're really hoping to bring in even more interdisciplinary experts and increase collaboration and create and maintain a space where collaborative opportunities in this area can grow. So now I'm going to kick it off to Dr. Jessica Rost, who will tell you more about kind of what we mean by big data in the first place.
Thank you. Yeah, so I think I'll go on to the next slide. Thank you. So a while ago, when we first started this group, we decided to undertake an activity of defining big data because we would meet about this big data work group, and we would talk over a bit what is big data. And then eventually we thought we should probably make a definition for this so we're all on the same page. So there's a lot of definitions out there of big data in different industries, different disciplines. So technology has their own definition, business has a definition. So we aim to make a definition that worked for us, which was specifically about big data in neurodiversity research. And there's a few reasons for this, and some of them are the limitations that you all pointed out in that form you just filled out. There's data that's not created for this purpose, or there's data that maybe is hard to harness for this purpose. So we ended up making a definition for us that pulled a little bit from these different disciplines, but really worked for what we thought was appropriate. So this is what we landed on: high variety data covering a diverse population that allows the user, us, you, to advance our understanding of population health. So I'll go to the next slide, and then I'll talk a little bit about some of these components. So we borrowed the word variety from some pre-existing definitions of big data. So if you're familiar with a more IT form of big data, they often talk about the V's of big data. And one of those is variety. And in this case, variety, it put simply means you have data of a lot of different types. So that means we have a lot of information that comes from different places. And when we think about our data that we think of as big, this is often true. So if we have a health record, we might have some combination of ICD diagnostic codes and maybe free text written information on medications or doctor's notes. Maybe there's information about the provider. There could be yes/no information about, did they do this? Did they not do this? So we capture this high variety data. That's an example of a health record. You can also imagine how this would be true of a survey or some other large form of data. We also thought it was important to include diversity, and you all already hinted to this a little bit as well. We need to be able to capture people with diverse characteristics in this data in order to make these population health inferences that I just spoke about. And diversity is important across many elements, as we all know. So we've got race and ethnicity, sex and gender. Laura talked about that a little bit as well already. Income, geography, support needs. And then there's also different policies that might be relevant to different populations. And so we need to be able to speak to these as well. And then finally, representation is the last thing that's talked about in our definition. So we know that the data, this big data, has information of a population or a sample from which we can draw some sort of actionable conclusion, because ultimately our purpose and our goal is to improve health and healthcare, or whatever the big data thing is. But we are in ARP today, we're talking about health. So these are the components of our definition, and I'll talk a little bit later specifically about some ethical uses around big data. And I know we all will talk about that a little bit, but that's also an important component of creating this definition for us. And next slide, please. I think I will pass it to Lindsay.
Thank you. So to broker our conversation today, one thing that we thought would be helpful was for us to be anchored in a few of the key components that you might consider and are essential steps for thinking about big data work. And many of these are similar to how you think about any other research study, whether it's primary data collection, that is quantitative or even qualitative data collection. There are similar themes in terms of what's needed for you to think about your big data research goals. And it starts with the question, what do you want to be answering? And this is often at the base, starts with what you want to focus on and where are you intending to advance the field of research, what's needed, and how will you add to it? What is non-negotiable for what you want to focus on? Because you are not likely to find a data set that will answer all of your questions perfectly. And so identifying a core question, set of questions, or even a set of triage priorities can help you determine how you want to balance the trade-offs in what data sources can and can't answer for your research. You can also think about your research question in phases. Sometimes we start with something that's exploratory and descriptive and thinks generally about how often things happen in groups. And then we can move it forward into more specific questions with more advanced and innovative methods for tackling how we can think about change in policy, practice, or clinical outcomes too. Once you have that set of core elements of what you want to do, then you can move into how you're going to do it. And the two components there that are really key as you're getting started include beginning to assess your data sources, starting to identify where you might be able to move things forward differently. And across many of the folks who are on this call today, I've learned in entirely new ways, applications of data that I've used for a long time that can be implemented anew, ways that I'm learning all of the time. And so keeping that mentality around in what ways can you use the data that's available to you, either in combination or otherwise, to move forward the field in the opportunities to answer your research question. And that keeping the limitations front and center is important for you as you think about your interpretation, as well as how you communicate your research findings. Your research team is a second key ingredient to getting started with big data. Thinking about the sets of expertise that you need in terms of methods, clinicians for thinking about interpretation of the data and how to operationalize or define or use variables, and thinking about dissemination too. Big data can be particularly well poised for policy impact. And so that's a place for having policy experts who can help to think about what your findings mean for systems is really useful. And we have a set of collaborators here at ARP who have been engaging in that work and learning more about system opportunities too. And that thinking about forming a team is really just, it's a crescendo. It's a way that you're thinking about things moving forward, starting slow, having a conversation or two, and then thinking about next steps. You don't tomorrow need to have all the right people at the table at the same time for your research to really progress meaningfully. And we at the Big Data Work Group are here and hope to identify ways to support any of your efforts across these three steps in a consultative fashion and regularly with our shared expertise. Next slide, please.
I think we can, is this my part? I think, yeah, next slide, great. So yeah, as Lindsay was saying, there are opportunities for the Big Data Work Group to really support all of the AIRP nodes in addressing some of their priority areas. And For this part of the presentation, we have some representatives from a few of the nodes today, and we'd just like to hear from you how maybe your group is using big data or thinking about using big data. And let's kind of go in the order that we have here. So I think we'll start with you, Priyanka.
Sorry, hello. So for the community-based lifestyle intervention node, one concrete example, I think there are different ways different topics we can touch on because of the scope of this node, but one particular thing that we have discussed about in our group, we have not necessarily gone ahead and done that analysis yet, but is looking at obesity and related chronic conditions, and understanding a little better from a data set, for example, from electronic health records, to understand some of the needs of autistic individuals, because in the clinical setting, we don't necessarily capture that very systematically. And as I think there was a comment that talked about numbers, not reaching enough numbers at maybe one particular site. So understanding the problem better through numbers at different sites, and also potentially differences at different sites. It's something that we have spoken about. And in the event that there are new medications that have come along in sort of treatment of obesity, I use them in quotes because I have a lot of opinions about the medications, but how do they interplay with like lifestyle behaviors, and like long-term, what effect does it have on patients? I think there's a lot we can learn from within this space through big data. I'll stop there.
Thanks, Priyanka. Okay, yeah, and I think there's some similarities too with, I'll speak on behalf of the gender, sexuality, and reproductive health node. And we have some priority areas in terms of like understanding health and healthcare experiences of autistic people who are sexual orientation and gender diverse. And we're also interested in identifying and addressing disparities in sexual and reproductive health and healthcare services, such as hormonal contraception use in autistic youth and adults. And then on the slide, we mentioned that we're also very interested in how autistic people experience pregnancy and what their obstetric care is like. So the projects in our node have mostly been making use of electronic health records, or EHR, from the Kaiser Permanente Northern California system. And I think there are other opportunities to look at other big data sources as well. And I'd be interested to hear more about that, such as Medicaid and so forth. And I think these big data have really allowed us to have larger sample sizes that would be very hard to get in other autism data sources. And we're able to look at a wide breadth of physical and mental health conditions in these populations, and also multiple types of healthcare, and how there might be multiple types of care disparities that are clustering together. And I think another strength of some of the EHR big data is that you can look at some of these outcomes longitudinally, and you can look at how patterns of care may change over a person's lifespan. And you can also look at just how care may be changing over time. And, maybe there are trends in care that are changing. And one thing I think a big opportunity area would be to use these kinds of data sources to understand reproductive health and healthcare experiences of people with multiply marginalized identities, including race, ethnicity, and socioeconomic position, and in intersection with autism. So I think that would be an exciting future use of these data. And I think moving on, Lindsay, do you want to share from health systems and services?
Yeah. I think one thing that's been really interesting is that in connecting, for example, with Dr. Hotez, there are ideas about how we think about identifying how people are receiving care, what they're receiving care for, that I've not seen explored in previous literature. And being able to come to the table together to say, we're not sure how this is going to work, and we need to think about the measurement components, engaging a collaborative set of researchers, clinicians, autistic individuals, and other stakeholders helps us to innovate and start to explore new ways to think about these research questions. And from a big data perspective, by observing what's happening for care in these systems, we're able to produce research that can translate to how this system creates eligibility for people to gain access to services they need, for people to access, once they're eligible, the array of services that are needed for their clinical care, and for us to think about how we might measure outcomes differently from some of the historical approaches that have informed policy and practice. So this has been an exciting, I think, catalyst for new ways to think about big data applications across many of our collaborations in all of the nodes. And we are so eager to be continuing to learn from it, as well as those of you here today, even looking at some of the questions in the chat. I think these are key overarching issues related to the use of big data in terms of co-production and engagement, and thinking about participatory options for our work. So I appreciate the opportunity to be here today, and the work in this node has been so exciting across these topic areas.
Yeah, and it's been really fruitful, for the GSR node to be in conversation with your node, Lindsay, especially around some of the reproductive and pregnancy health work that we've both been doing. So I just want to make a plug for that cross collaboration is really useful in thinking about, how can we work together to make the most impact, right, with our different studies.
Even geographically, I think talking about California, talking about Pennsylvania, being able to think many of our, at least my ways that I think about research questions or research opportunities is based in what's happening in our backyard in Philadelphia and in Pennsylvania. And when we're connecting, I think, in a more national way, as this big data work group has been across these nodes, it is changing for me the way that we think about those priorities to be more impactful. It's not limited to what's going to work in those smaller geographic areas, but more broadly, how can we make this fit? So really exciting.
Mm-hmm. Yeah. Okay, and I think the last node representative we have is Rujuta from neurology.
Yeah. So I think one of the research areas that's noted here, and I alluded to in my introduction also, is this interventional studies to improve or mitigate neurological symptoms in autistic patients. I think beyond that, there's a few other aspects that the neurology node also focuses on, which is just globally better understanding these highly prevalent co-occurring neurologic conditions in autistic individuals. So for example, epilepsy, sleep difficulties, motor conditions, neurodegenerative diagnoses, and understanding the prevalence of these, being able to use that type of data to educate other care providers, both neurologists and non-neurologists, because the reality is many adult neurologists and even child neurologists aren't as well educated in the area of autism and medical conditions that might be associated. And then also understanding sort of treatment patterns or referral patterns as a part of this. So to get more specific on that, for example, what some of the aspects of looking into big data is epilepsy is a well-known co-occurring condition in autistic individuals, meaning higher prevalence in autistic individuals compared to what we deem the general population. And there have been several studies, many sort of highlighting this, and many neurologists are aware, but many of those studies often face an ascertainment bias, right? They're taken from maybe tertiary clinical settings that are maybe providing care to a high level of autistic individuals with differing intellectual levels as well, which we know can affect the rate or prevalence of epilepsy. And although there's some biases to big data, it allows us an opportunity to look at another larger sample where we've largely worked with Dr. Shea and Medicare and Medicaid data to understand prevalence rates of this, and also understand it in the setting as these terms are deemed within the Medicaid data in the setting of with and without intellectual disability, which is something that's very important when we consider about the identification and treatment of these neurological conditions. So there, the example being, what is the prevalence in a larger data set? How does that vary across different cohorts that we might be looking at? And in turn, what that's also, thanks Nellie, what in turn that's also allowed us to better understand is how are these diagnoses made or not made in these populations? So for example, a lot of these data is based on ICD-9 and 10 coding. And the reality is perhaps autistic individuals aren't getting the same diagnoses, at least we're seeing perhaps as we're looking at these data, that maybe a non-autistic individual might be getting. Just one sort of anecdotal example from our own research, which we're still looking into, is, the idea that maybe autistic individuals aren't getting the same coding for sleep disturbances, for insomnia or other sleep impairments. So how can we best leverage this type of data to better understand, is it the lack of those diagnoses, or are there other reasons why we're not seeing sort of prevalence rates that have maybe described in the literature otherwise? Also allows us to know that maybe potentially something that we could explore, or others could explore, and we'd be very excited to talk about people who are interested specifically in the neurology node, are referral patterns for these individuals to higher level practice providers, or medication treatment patterns for these individuals also, when it comes to co-occurring neurologic conditions like sleep difficulties, and how can that better inform clinicians on both what's being done and or what else could be done and where the gaps are in care. Just given the time limit we have on this segment, I'll stop there for now, but very, very excited to continue any conversations with individuals, both CREs and those attending who might be interested in specific neurology related questions. Thank you.
Thanks, Rujuta. Yes, so I think the kind of descriptive analyses that we can do with big data can be very powerful. Put evidence down that didn't exist before for some of these, harder to study outcomes and types of care. So I don't think we have representatives from the other nodes today, but if you are here and do want to say something, I think just you can put it in the chat and we'll keep going. So next slide.
We'd now like to turn to discussions about big data and participatory work. So generally when we're talking about participatory work or participatory autism research, we're referring to ways of involving or collaborating with autistic people and or family members, caregivers, or any other allies in making decisions about research. And these decisions can include what research gets done, so what the topic of the study even is, how it gets done, so what the methodologies used are, and how research findings are used. So I would love to turn it over to the audience and hear from all of you. And when you respond, feel free to unmute yourself, raise your hand, or put your ideas in the chat to contribute. But we'd love to hear from you. How can participatory research approaches be used in big data autism research? We'd love to hear your thoughts as well as any successes and challenges that you might have faced. And I am seeing a hand, but I cannot see the hand, Calliope. Calliope, are you able to unmute? Okay, it looks like Calliope might be having audio issues. Others, any thoughts about whether participatory research can be used in big data autism? So Brittany says it can be useful to select a big data source together. Absolutely. And I know in working with big data, that is so helpful. You know, when we think back to what Dr. Shea was talking about in terms of kind of the workflow for big data, oftentimes we approach a project and think, I want to use this data set, but really we should be basing those kinds of decisions off of our research questions, which would ideally be developed in collaboration with autistic individuals. Absolutely. So Juliet.
Yes, that's what I was going to say.
Oh,
we
perfect.
did it together at the
Perfect.
same
Yeah,
time.
please, Heather.
Juliet, do you want to say, because I know you have lots of information to share. Juliet is in a measurement program at TC Columbia, and she's an autistic researcher. So I know that she has a lot to share. So Juliet, do you want to share?
Can you hear me?
Yep.
Okay, awesome. Yeah, I guess I just wanted to say, I think it's hard to include participatory research in big data projects. The participatory projects that I've been on as an autistic individual myself, and also on the side of a researcher, have been more qualitative. But I think including autistic researchers that have statistics experience could be a good first step, but also just asking the community how they feel about big data, because sometimes they can be weary about it. There was controversy over a big genetic study last year or something in the self-advocacy community. But yeah, I think just building those relationships with the community about that they have nothing to be scared of, I guess.
Yeah, building trust.
Yeah, building trust. And then just also thinking about how to disseminate the information once you're finished the study in a useful way that a layperson could understand, because it might be statistically heavy.
I think that those are amazing points. I know a lot of the times when we talk about partnering with community, one of the most important ideas when we partner with community is the idea of they come as lived experience experts, but not necessarily have a lot of information about how the research process necessarily works or background in it. But in something like big data, where you're not having those core underlying concepts, that could get you into a lot of trouble. So I think that's a really good point, Juliet, that could be an additional challenge of using these processes in this way.
Yes, thank you, Juliet. I absolutely agree. Priyanka.
And to that point also, I feel logistically reimbursing someone or bringing on someone who does not have that particular big data experience necessarily can be challenging, just logistically and administratively, because it's an easier argument to make when you're doing a community-based program, getting on advisors or community experts. But in something like big data, I could foresee someone being why does someone external have to look at I'm thinking of electronic health record data, what connection we have experts in-house, why do we need someone external? So data security questions that may arise, but I'm curious to see if others have done this successfully.
Absolutely.
I agree. Lindsay, did you want to add or take us on a different direction? Oh, we can't hear you for some reason.
Because I was muted. I didn't unmute. Problem. One way that the big data work group might consider next steps in terms of how we think about some of these issues are potential for things like data visualization to help be a path toward taking what are big numbers and sometimes big or complex statistical approaches and making them meaningful for people who you might work with who could help interpret the data. We have some work planned on this with a project focused on aging that is underway and will be happening over the next year or two, but this would be a wonderful way if you all are interested in this topic, to continue to tune in to the Big Data Worker to partner with us to think about these approaches and these options. I would be very eager to have those conversations.
That's excellent. Yeah, and in my own experience, I know that when I've worked with big data sets, I've been surprised at how many decisions that I have to make along the way. And I have done big data projects both with and without autistic involvement or collaboration. And without, I really struggled in many ways because so many decisions, certainly there are data-driven decisions that need to be made based on the numbers, based on the limitations or constraints of the data set. But so many of the decisions that you make are conceptual or theoretical or reflect values that are not based in a number. So that has definitely been a strategy that I've increasingly tried to use in my research. I want to go to our next discussion question. If you just click, it should show up. We're very interested in hearing from the audience. Why are big data autism projects helpful for understanding the needs of the autistic community? And if you click it twice more, I think, multiply marginalized autistic communities. And what are the next steps in this area? What is the utility of having a big data project specifically on this topic? We're very interested in hearing from any of you. Feel free to put it in the chat, unmute, or raise your hand. Co-occurring condition prevalence. Juliet, would you like to say more about that?
I just think there's a lot of co-occurring conditions within autism and neurodiversity. So maybe like knowing a better, like what was said before, knowing like the prevalence of epilepsy or something like that would be helpful for the autistic community, just to prepare in case so we know like our chances of having a co-occurred condition.
I agree. It's a good point.
Yeah, absolutely.
Or
I
Jennifer.
see another hand. Jen, yes.
Yeah, I think that big data projects can be a useful starting point for understanding a topic or an issue. If you're interested in understanding the prevalence or disparity in some kind of health or healthcare issue, it can be useful, but it's not always like going to answer all the questions, right? And I think this came up a little bit with some of the node discussion, that some of the necessary next steps would be talking to autistic people directly to better understand like what is happening with some of their experiences, like how are some of these healthcare disparities coming up? What are their interactions with their healthcare provider? Some of that information won't be in these big data sources. So I think it's a complementary tool, but it's not always like the end all answer.
Absolutely. And we're seeing some great responses in the chat as well about, actually making it accessible for autistic collaborators and multiply marginalized autistic collaborators to contribute in a meaningful way to big data projects. Absolutely.
Brittany, would you like to unmute and just give us your perspective? Because it seems like some people are agreeing with you, and I'd love to hear it.
There we go. I was really struggling to find the unmute button. Thank you for sending that my way. Yes. I think especially when thinking about, intersectionality and thinking about big data, the hope, right, especially with variety data, is that the origin of that data or the source would have the markers so that you could start to really assess differences across multiply marginalized autistic communities, or even similarities, right? What are we experiencing across these communities that's similar and different, and how can we compare, especially related to different outcomes, and especially considering, an intersectional perspective when taking this approach to research. So just thinking about some of those ways. And then Priyanka added a great point in the chat that I was commenting to about the complications of already accessing multiply marginalized autistic individuals and communities through research, and really making sure that you're compensating them appropriately. And again, participatory methods are more ideal for that, in the sense that they can actually be, again, a part of the research endeavor.
Absolutely.
Excellent points.
Could we go to the next slide? Heather has an excellent example that might also help inform our thinking.
That's all the slides I have. Give me 1 second. See if there's more. I'm gonna stop sharing for a second.
While Ben's looking, I just wanted to share in the chat the research basics training that was created by some autistic collaborators of Answer and our node, that was designed to make research more accessible to community members. I think for me, a lot of times my people who are engaging with me in my projects are people from my network, and I'd love to reach deeper into the community and find people with a big diversity of experiences. So I'm just going to share that in the chat in case people are interested in it.
That's awesome. Thank you so much for highlighting that. I wanted to highlight it too, and you already did, so great. I don't want to take too long. They basically asked me to give you a concrete example of how it might look if a participatory research team was to work together on a sort of a big data project. And so we recently published a scoping review around supports for autistic college and university students. And I'm not going to go into all the weeds and the detail. I'm just going to give you the high level. Essentially, we proposed, that we're going to use a particular framework to sort of look at the data and sort of organize it and according to different factors, let's just say. And all of these factors are in the research. But when we present that kind of information to the ACPs, our autistic community partners, basically they start saying things like, well, you haven't captured this, or you haven't captured that, or you need to look at this, or you need to look at that. And we ended up almost with sort of two parallel coding, like the original coding that we had done, and we sort of summarized those results. And then we also summarized the results for these really important factors. And so I guess it just made the entire project much more meaningful than it would have been if it had just been under our control, even if I am an autistic person helping to lead the team. So that's my very short example, and I will pass it back. Next slide.
So I'm back to talk about a little bit more of our thinking of our use of big data. So as I mentioned, the other part of this that we undertook was that we wanted to talk about ethics and big data, and how when I say ethics, I mean as data users and as the group in which we were discussing it, what do we take on before we decide that we want to do a big data project? And how do we think about using big data as the researcher in a way that is ethical and is in concurrence with the field and making people's lives better, which is our ultimate goal. So I'm going to go to the next slide, please. And I'm going to go, I know we're running out of time, so I'm also going to speak quickly, but we wrote a blog about this topic, so I'll put the link to the blog if you'd like to read more information about it. But basically, we came up with these 5 principles that guide our use of big data, and we think it could be useful for more people to take on some set of ethical principles guiding their use of big data. because big data is very easily accessible. There's a lot of information out there and you can do anything with it. It's not, well, not all of it. Some of it's driven by very strict IRB guidelines and different ethical considerations, but for the most part, you can really look into anything. So in general, we aim to be credible. So we are looking for data that is recent, it's complete, it's trustworthy, and we'll use this to develop responsible, meaningful research questions. The next, we aim to be responsive to the community, to people we're working with. So we want to put out work that is responsible, responsive, respectful, strengths-based, and non-pathologizing. We aim to be ethical in our use of the data in a way that we're actively combating ableist philosophies, and we're being inclusive in our research. We aim to put out information that is significant and impactful and innovative. And ultimately, we hope that it's meaningful and actionable. And this is not speaking about statistical significance, if I need to clarify that point here. And then finally, being transparent. So being very open about what the data is, what it isn't, what limitations there might be, what exclusions or who might not be represented in the data, and other things that inform people in how to look at the information we've given and how to find meaning in it. So I will paste the blog link in there in the chat as well, so people can read more if they're interested. But this is the start of the ethical principles that guide our data use as a team. So next slide, please.
Yeah, thanks, Jess. So I will spend a few minutes talking about some of the real world implications of big data to end our discussion today. So we wanted to spend just a few minutes talking about really why we do this work and how we can kind of start thinking about some of the real world impact of big data. So we have a few broad questions here around what are the practical implications of our big data results, who might benefit from this work, and are there specific areas that we might hope to impact. So these are really big questions that we can't possibly answer in just a few minutes today, but I think it's helpful to start thinking about the translation of this work into policy recommendations and opportunities. So I have just a few examples to share to help us think about this as we start up this data working group. And I think thinking about these implications as we are forming research questions that could conceivably be answered using big data might be a helpful practice and could kind of help fine tune those research questions as well. So, so I have a few Pennsylvania specific examples of ways we have made or have attempted to make data actionable. One is the Pennsylvania Autism Census, where we have collected data on the number of people with an autism diagnosis living in the state of Pennsylvania. And the purpose of getting the census was to get an estimate of the number of people and also to learn about the demographic characteristics of this population, to really better understand some of the gaps in services and the scope of need for services and programs across the state. So the goal with this was also to translate these data into effective policies and to inform, to better inform service planning for people that are receiving services throughout the state. And then similarly, we've conducted a Pennsylvania Autism Needs Assessment, gathering data from people that are receiving services on their preferences. So are there gaps in the services that they're already receiving? Should we be allocating more or different resources? And then another way that we're trying to translate this data into action and to really identify this this data to impact pipeline is through some opportunities to share data in different ways with different audiences. So one example that I think is important to highlight here is that we create some accessible data dashboards using data like that from the census or from the needs assessment that I mentioned. And we share those in a data discoveries article that is published bi-monthly in a state-run peer-reviewed journal that targets direct service providers. So we create this data dashboard, we write up a brief summary to go with it, where we highlight a few insights and some ways that data might impact practice or the way that service providers actually directly provide support. So one article that we submitted, for example, recently included data from the Pennsylvania Autism Needs Assessment on preferences in community participation by age group as part of this upcoming issue that's focused on aging. So service providers have the ability to sort of filter results by age group to look at some of the difference in preferences by each individual age group. So with this, we're really trying to get data into the hands of the people who provide direct support so that we can really better align resources with those preferences. And I will share another link in the chat because I realize we're short on time about the policy impact project that that this group might find interesting.
All right. So to wrap it up, I just wanted to reiterate that we are kicking off our big data work group office hours. And this is really for anyone who's interested in coming and chatting with the group that have spoken to you here today. I'm really excited to learn about new sources of data and how people are using them. There's a few I'm really curious about, and I'd love to know, what other people are working on, what your ideas are, if you want input on specifics, or we have a lot of expertise on our team, not necessarily me, but on our team, about data sets that can answer certain questions. And for me, it's been super helpful to talk to people who are really familiar with a lot of different data sets and say, hey, is there anything with a good gender identity variable and an autism variable out there? What kind of sexual health variables are in these different data sets? I can look, but maybe I'm missing stuff. So please come on. If anyone else wants to say anything about these, that would be great. But we'd love to have you come and talk with us and talk to us about your works in progress.
Thank you, everyone. Before you head out, please respond to this poll, and we are happy to reach out to you regarding any opportunities to collaborate with the Big Data Working Group. Thank you so much for all of your attendance and participation. We really enjoyed learning a little bit more about your work, and we hope that you reach out if you're interested in collaborating with us in the future. So thank you, everyone.
Thank you.
Thank you all. And just a reminder, this webinar has been recorded and will be on our website.
Yay.